Okay, so here I am. I'm going to share a video of a conversation I had with a facility that treated my father for cancer. And how me being involved in that treatment has affected my health. Um, I haven't been able to shake off the symptoms um, that I describe in that conversation that started several months after, but I know that they had to do with that exposure. My father did not have any symptoms of cancer, and why I'm warning other people about being cautious at least and having the proper discussion about the chemicals involved in everything and how they might affect you. If you're having dental work done, in his case, he had a new set of partials done or a set of partials done for, I believe, his upper mouth, his upper teeth. Um, I went with him to pick up the partial at the place which is located in Las Vegas, a few blocks from our home. It's called Rain Springs Dental Group and Orthodontics. I went with him because he invited me to go to have coffee with him afterwards, and I just decided that was okay, right? And I went with him. He went and picked up his. It wasn't that long. It was like 10 minutes or something that I waited in the car. Um, he went and had them picked up. He had them fitted. Um, Several days later, he complained about the pain, and I don't know how many times he went back over there. Um, I went to the Bad Owl Coffee House for the first time and only time that time. Um, and we went back home. Uh, After several months lapsed, he was diagnosed with cancer all of a sudden. And there are chemicals involved when you go to a dental facility and you have a mold made of your mouth, of your teeth, and I don't know how toxic those things are or if they can trigger cancer, but my father did not have any symptoms of cancer or any diagnosis of cancer or deterioration the way that manifested in him several months after. And I also drove my father to the place where he had all his imaging done. What I wasn't expecting was that short of an exposure to a radiation therapy or just putting my dad onto the bed or the platform would cause me the kind of symptoms that I've had. And so after the conversation, I will share some of the photographs that I've taken of the environment around the home where we lived in Las Vegas afterwards. And I have other video of phenomena radiation is everywhere, but I don't know now how much of it is magnetized to me and how it affects me. But it's not necessarily something that improves a person's health. And that's the point that I'm trying to make here.
Radiation oncology, this is Jennifer. May I help you?
Hi, can I speak to Danielle?
Can I tell her who's calling?
She called me yesterday. My name is Alan Jong. Last name is Jong.
Okay, one second, please. Hey, Alan, it looks like she's in a meeting right now. Can I transfer you over to her voicemail?
It's all right. I'll call back then. She was in a
Okay.
meeting yesterday when I tried calling her back.
Yeah,
Okay.
I don't know what, it's kind of scary, but I don't know what's going on. She's in a lot of meetings.
Well, what I wanted to know really was
Mhm.
what machine was that I was exposed to when I brought my father into radiation, the second treatment. I tried to explain to her because I had just woken up when she called me. And the information that I need to know is what the name of the machine was and what type of radiation. Because I explained to her what it felt like when I was doing this. Um, the doctor was standing about 20 to 25 feet away. Um, he had me bring my father into the room on the wheelchair that you guys had out there. I had to use one of those wheelchairs to take him out of the car. And
Okay.
then as I was approaching this machine that was on and had a loud hum, it felt like it was attacking my limbic system, possibly the bone, something magnetic in it that kind of felt like it was crushing the bone marrow out of my bones as I didn't
Oh,
think it was going to be something that affected me long term because I was doing it like I was just getting my father on there, but as soon as I started feeling those kind of symptoms, that kind of feeling from the machine, I wanted to kind of get that as quickly as possible. I don't know if that hurt my father too, because he never came back from the first treatment. So I need to know what kind of machine I was approaching and setting my father into, and I don't believe that I was supposed to be doing that. I believe that you guys possibly set me up to live the rest of my life injured in some way or to die the way my mother died. I don't know if we took back some radiation to our home. My mother did pass away from a different thing, but she was she and I've suffered from some kind of chronic fatigue syndrome, nerve damage to my hands and my scalp and my head since that since I did that. And I just want to know what kind of radiation I was exposed to.
yeah, she would definitely be the person to talk to. Let me try her. Let me keep trying her, okay? Hold on. Alan, I keep trying her, but I can't get through. I even
And
sent her a text off my phone. I haven't heard
you
back
don't
from
know
her
what
yet.
kind of radiation, what kind of
Oh,
machine that
you know
is.
what? I
That's what
used
I
her on the
wanted to
phone.
know.
I don't have that. I don't have that education.
Okay.
No, I wouldn't even know.
All right,
But yeah, she
that's
was
what I
one of
wanted
the
to know
radiation
so that I
therapists
could.
for years.
Okay. Okay, so she
Yeah.
was a radiation therapist for years.
Yeah.
All right.
That's her.
Well, I just wanted to
Yeah.
know because I don't know if you've ever been in that room when the machine is on, and
I've
I don't
had
know how
treatment.
close
Yeah.
you've had treatment and you survived it,
Yeah. On my face. Oh yeah.
and you don't feel any numbness on I'm talking about that big machine that has that hum in it and that feels like
Yeah.
as you're approaching it, it didn't feel like it was ripping bone marrow out of your skull or
No,
your
I
brain was
never had.
falling
No.
through it. You didn't feel anything like
No.
that?
No.
And you
They
said you've
actually
had
treated
treatment.
my face. No, I never had any side effects. It got a little red, but then it went away before I was even finished with my 30 treatments.
Your 30 treatments?
Uh huh.
Okay, well, I don't believe you. I don't believe you, sorry. I don't believe you've even gone through the treatment there. Um,
Well,
uh,
I was treated for skin cancer.
okay, my
So
father
I
was
mean, every
treated
every
for a small cell lung cancer that supposedly spread to his brain. I think my father possibly was poisoned, actually. I don't know because he became ill way too fast. I still have his imaging from. I have all his imaging from the place that he went to originally, which was St. Rose, Dominican. I don't
okay.
know how to read that imaging. I don't know why they recommended him that kind of treatment. Um, they call it something small cell something. I don't remember the full name of it, but he went through a treatment that was pretty devastating, and it impacted me just from
Yeah.
helping him get onto that machine. So that's why I say I don't believe you that you
Well,
actually
that's okay. You don't
okay.
have
I
to
don't.
believe me.
And that you went through
I've
30
had the
treatments,
treatment.
I don't believe it.
Okay.
All right. So that's well, will you have her call me back then? She has my
I
number.
will.
All right.
Yeah, I
Thanks.
will.
All right. Bye.
Okay. Bye. Radiation oncology. This is Jennifer. May I help you?
Hi Jennifer. Can you transfer me to Danielle?
Sure. Can I tell her who's calling?
My name's Alan Jong.
One moment. Hey, Alan. It's Danielle.
Hi. Okay, so I talked to my sister the other day and she says that you guys contacted her.
Yeah.
Okay, the reason why I'm calling you back is because when I asked you what kind of machine, what kind of radiation I was exposed to. You brought up something about a power of attorney. My mother passed away. I don't know if it was because of exposure to radiation from the radiation treatments that my father got. I don't know if that was a progressive disease. Well, she actually did not. She was murdered in a fucking hospital in Las Vegas, and I'm going to sue them. But I want to know why it was that you guys did that to me, and what am I experiencing now? Because the symptoms that I've had since that time, since I took my father into that chamber, the doctor was standing several feet away from, like 25 feet away from the machine. Okay, he had me bring my father into that room and lay him on that bed while the machine was on, and I was feeling something, and the symptoms that I have are similar to polio or something. My legs give out real easily. I have problems throughout my body since that time.
So I explained this to you before, and it's the same thing. We would never expose anyone to radiation except for the patient. That's just the way the system is set up. So
how many times have you had relatives bring their relative into the room with the machine on?
Fairly often. Well, the machine's not on. The machine's not on. We would never have the radiation on and running with anybody in the room besides the patient. Not even
I
the
don't
staff, and
believe
not a
you.
family
I don't
member.
believe you because of what has happened to me since. I don't believe you. And I want to know what kind of radiation I was exposed to. What is the
So
name of the machine? All that
yeah,
stuff so that I could do
I
the
can give you the name of the
research.
machine. I can give
Okay.
you the name of the machine, and I can give you the type of radiation that we deliver here.
Okay. I'm ready for it.
Let me just so it's Varian is the manufacturer.
Okay, how is that spelled?
Varian.
Okay. And what kind of machine?
And the kind of machine is TrueBeam. TrueBeam.
TrueBeam.
Yeah, true, like the opposite of false.
Okay.
TrueBeam.
Yeah. BEAM. It's all one word.
Yep. So
Okay.
Varian TrueBeam, that's the machine.
Okay.
And the type of radiation we deliver here are photons. PHOTON.
Okay. And what exactly? Okay, so you guys have this machine on all the time? I mean, like,
No, so the
okay,
machine is only on when we push the beam on button.
okay,
The machine stays on. Now, so I'll tell you, the machine stays on, but the radiation is only produced when we push the beam on button.
and
And that has to be done physically by a radiation therapist.
Okay, so
just because the machine is on, it's not producing radiation.
And is there a lingering effect in those photons?
There's not.
Okay.
So when we treat the patients,
my father wasn't toxic when he got back in the car. You're claiming that he wasn't toxic being like getting back in the car. No,
he was not radioactive. Okay. He was not radioactive after his treatment, no.
Okay. All right. Well, that's your opinion, or that's the standard?
No, that's a fact. I mean, that's a fact. You can ask anyone in the industry.
All right. Well, I have concerns over what happened to me afterwards. All right, and that's a legitimate concern for me. Whether you believe it or not, or whether you have your reason to counter me, I still have a legitimate concern about it because I'm the one who's suffering from whatever I was exposed to there. All right?
Alrighty.
And you're sending my sister the copy of the medical records?
I told her that if she requested them, we could. But as far as I haven't heard that she did request them or not, but I haven't.
Okay. All right.
Yeah.
All right.
Okay.
Bye.
Alrighty.
So these are pictures on a phone that my mother bought me in 2021. And so I had pictures from a prior phone, the phone that my father owned. I had up until the time I replaced it with this one. And my brother took that phone, and the pictures that were in it were lost in the process. So I only have the ones that I uploaded to the internet from his phone. And then it starts off from here with the different type of situation. So after my father had his partial made, and I don't know how toxic that was, he developed cancer. I went with him to pick it up, and then I know that it fitted him poorly and it hurt his mouth, so he had to have it refitted somehow at some point in time. Okay, so this is just me standing in my room taking a selfie. That was the first selfie I took with that phone. But this was, I guess, that evening I was out in the backyard and looking at the clouds and saw this structure, and I took a picture of it. The moon was behind the light there. And you can see that it does do something here. I don't know if these are the effects of the radiation, my father's ashes. I don't know what caused this kind of phenomena to happen, but it is there. It wasn't something that I invented. It is something that was just there. Right. My father was cremated, but the facility that he went to did expose me to radiation, and I'm not sure to what extent.